morning. It is July, what is today? The 17th. And I am headed to clinical. So I thought I would actually start something where I would say, come to clinical with me. So we are headed to clinical. I am, as you know, I am a nurse educator. And so we are going to clinical today. And we are going to a new hospital that I've never been to. And I teach at 2 different schools. So as you know, I teach at a HBCU full-time, but my part-time gig, I teach at a well, it's a university, but I teach in an LP and RN program. So this is basically a program in which the LPNs, they're already LPNs, and they are bridging over into a RN program, BSN program, or they will be BSN prepared nurses once they graduate. This is I want to say an 18-month or 15, 18-month, I'm not sure which one it is. I've asked them, they told me 2 different things, program. So it is accelerated, and we are going to a hospital in a small town. It's about an hour and 4 minutes from my house, and I'm an OB nurse, so of course OB is what I'm going to be doing today. So I'm going to take you along with me today to just kind of see how the day goes. I will not be showing students because of just privacy, so be mindful of that. So basically all you'll have in these type of videos is just kind of snippets. It's no different than being in the hospital. I won't show students, I won't show patients, I won't show anything like that due to HIPAA and all the other stuff. But I will kind of go through the day and kind of take breaks throughout the day and kind of say where the day is going and things like that. So you can follow me as a nurse educator and see what I have to think about, what I have to do when it comes to clinical. Now, what I can tell you is I have 4 students that's going to be with me today. And that's really all I can tell you. 4 students is going to be with me today. We're going to be on the OB unit. And again, I've never been there before, so I really couldn't tell you much about the unit, but I will try to show you around if I can, if I have opportunity to. But if not, then I will kind of check in throughout the day and say, okay, this is what's going on. My students have this many patients, this, basically like that. So anyway, yeah, so let's go ahead and do this. I will see you when we get to the hospital. I guess this is the hospital. Oh, no. Yeah, this is the hospital. All right, so we are actually here. Again, I've never been here before. Let's see, visitor parking. Yeah, let's see how we do this. So this hospital I've never been to before, like I said, and the parking lot seems full. So let me think. Let's see. Visitor parking is this way. All right, let's go. Hospital before, and so it's always a little. So you may be like, what do you feel like as an instructor to go to a place that you've never been to? You don't know how the floors ran. You don't know nothing. Let's see. Same day in surgery. Let's see, where do I need to go? So to answer that question, as I'm trying to figure out where to park, employee parking, because we'll park over here and right here. Seems fine. All right. So you're like, what is it like to go to a hospital you've never been to before, do clinicals with students? And it's a little the same anxiety that students experience when they first come to clinical, especially to a new site, is the same anxiety that I kind of experience. Not to the same degree, obviously, because I've been doing this for education for 16 years. So I just learned to roll with the punches or whatever happens when it comes to clinical. But we will see. Masks are required, which I have. I need to put it on. That's why everybody looking at me crazy already. Like, where's her mask at? Anyway, so yeah, I had the students told them to meet me in the main lobby. So, because I don't know where nothing else is. So if you don't know nothing else, have them meet you. If you're an instructor, have them meet you either in the main lobby if it's open. It is Saturday, or the ER lobby. You do that on the first day, and then after that, you figure it out from there. So this is the hospital right here. We're walking in, And I'm gonna see the students, so we'll see. I'll come back a little later. So here I just want to show how at this hospital they actually have a canine dog and a sheriff deputy to sniff out drugs and such. And he was just kind of showing us some tricks the dog could do. So it was just great for the students and myself to see, because I've never seen this in a hospital setting before. So that tells you something about Tennessee.
No.
Those monologues are the best.
They absolutely are.
All right, so we are going to do room chronicles. And this is an empty room, but I want to come give you an update. It is now about 11 o'clock in the morning. We have about 17 patients on the floor, and I have 4 students, so they all have 2 patients apiece. Some of them have couplets. This floor has antepartum, GYN, mother baby, and med-surg overflow. So they are busy up here. I gave the students assignments. I walked them through a bubble her assessment for their postpartum patients. And I want to say that's it. And so then I'll let them be on their way to get stuff done on their own. All right, so that's basically what I did. I have them all split up. I did a bubble her assessment when we first came in, explained to them what it was, and then I've been to each room with them individually to walk them through just the focused assessment on the fundus and the bleeding. And then I'll let them do their second patient by themselves. This afternoon, we will actually do assess our babies, and we'll do that together so they have an understanding how to do that, just to split up the time. And not only that, just not to overwhelm the patient. Hospital's great. The staff is great, and they'll let us do what we want to do. So we will be hanging antibiotics today. So starting at about 11:30, I will start hanging antibiotics with the students, and they're getting a great experience at this facility. So I'm actually happy that we're here. I'm actually going to see if I can come back here next semester. I do like this facility for OB. So that's an update for now. We're going to go to lunch sometime after we do our what am I talking about? After we do hang our antibiotics for all our patients. They're actually starting IVs here. This hospital is letting us do whatever we want, which I am happy about. So anyway, that's an update for now. I will check back in a little later. All right, so I am back. It is now 3:40 in the afternoon. And what has transpired thus far is the students are doing fine. But I went to go hang an antibiotic with one of the students, and one of the nurses decided that she wanted to take over. And I'm really not a component or proponent of my students being with nurses in terms of them shadowing them. I don't believe in that. That's just me. I'll explain that at another point. But she decides that she's going to just basically take the stuff out by hand and show the student what she wants to show the student. The problem was with that was I'm the instructor, so we're not doing that. So I said, no ma'am, if you can go ahead and hand me the stuff back, I'm going to show them what we need to learn based off of what we teach them in the program. And she huffed and puffed inside and wanted to try to take over. I'm like, no ma'am, we're not doing that. Not doing it at all. So I took her to the side and said that, so you don't do that in front of people. So I took her to the side and said, no, that's not how we do our program. So we got that taken care of. But since then, we have hung antibiotics on several patients. They have this new feature that I want to show you. Let's see if I can find it. I don't see a pump in here. If I find a pump, I will show you, or I'll show you tomorrow, because we're coming back tomorrow, about how it works. But they have this feature where in their Cerner, well, they scan the medication in the computer, and then they scan a QRS code on the pump, and the computer talks to the pump. And I'm like, that is so cool. They showing me all kinds of new stuff here. And this morning I'll show footage of the dog. They have well, I'll talk about that when we get in the car chronicles. So we'll talk about that in the car, but I can't talk about it right now. Anyway, it's been a good day. So we had lunch at 1 something, which is very late for me, but it was still great. The food was okay. It took a little time to get our food, so our lunch was only for about an hour, but we spent 35 minutes waiting on our food. Another story. And then we come back, and then the students are working on their documentation and stuff like that. And now I've sent them out to go ahead and go say goodbye to their patients for the day and wrap up anything that needs to be done. And we're going to go to post conference at 4 o'clock. So that's pretty much what's happened today. Stay tuned, because then I will come to the car chronicles and talk to you about what I need to talk to you about in my car. So talk to you later. I'm back. It is 5 o'clock in the afternoon, and we are ending our clinical day here. I'm walking to my car. I needed a drink, so I got a Dr. Pepper. And I've backslid because I had got off sodas for a while, but now that I'm back in the clinical setting, it seems like I'm back drinking sodas again. But anyway, not clinical setting, but doing clinicals, shall I say. So now that I'm walking to the car, I can talk. So we had a situation this morning where, and it's kind of hilarious when I think about it, but so there was a sheriff deputy with the canine dog, and I was up here like, oh, he was showing us how this dog was doing tricks and stuff, which I thought was hilarious, right? Dog was doing tricks, and I will try to insert footage if I can. But last I knew, those kind of dogs wasn't allowed to do stuff like that, but maybe they are when they're with their owner. I don't know. The thing was this, though. So the students were saying something along the lines, oh, they have therapy dogs here. All right, so I am back. I drove to another store to get off their property, but today, so I had the privilege of seeing a canine dog that I thought was a therapy dog. Y'all gonna be like, you crazy. So the students were telling me that they have therapy dogs at this hospital or whatever. So the canine officer, the sheriff deputy with his canine dog, was showing us some tricks or whatever. So I'm like, oh, okay, this is pretty cool. This is pretty cool. And ended up that it was actually a canine officer, because they was actually working that day, because this particular city is known for certain drugs, and so they have a canine officer at the hospital. Now, in my 17 years as a nurse, I ain't never seen a canine dog at the hospital actively working to search for drugs. So that was new for me. I was kind of like, wow, you know. Then today I also saw someone who had an IV in her shoulder. So I'm kind of like, where they do that at? So I got to see so much stuff today. And again, I want to show you the pump, and I won't be able to show it to you today, but I will show it to you tomorrow if I can. So I just kind of wanted to, you know, give you an overall. The clinical day went great. I had a great time today. The students were great. There were no issues. And with that being said, I mean, I have no complaints. But now that we are here, I want to show you that I actually went to Ulta, because I want to stop by Ulta to pick up a few things. So since we're here, we'll go ahead and do a vlog and a haul. And I picked up the Jelly Pop Dew Primer today. I've heard a lot about it. Finally got my own for $10 at Ulta. I picked up, LA Girl has some new lip pencils out called the Shockwave Lip Nude, or Nude Lip, or whatever. I got two colors. I got Rosewood, and I got what's this other one? Rosewood, and I'm not gonna swatch them because I'm about to go Chai Latte right here. This is the colors, what they look like. So I picked that up, and then I also picked up, Buxom has some new lip plumping nude color lip glosses. And so I picked up the one that says Papaya Pumpkin, and it has like a I don't know, I'll show you. And I got this right here. So this is what it looks like. You can't see the little sparkle or whatever is in here, I don't think. Yeah, you can kind of see it a little bit. It reflects. So anyway, I picked this up today at Ulta. So I had a little haul, had some time. So I'm about to end this part of the vlog, and I'm going to go to the gas station and get gassed up, because this clinical site is about an hour and 5 minutes from my house. So I'm going to get gassed up, and I'm going to go home, and I may have you come with me when I get home and show you the process of preparing for clinical tomorrow. I mean, I don't really do a whole lot. The biggest thing I need to do is basically pick out some scrubs and go from there. So I may see you when I get home, but if I don't, I'll see you in the morning. Good morning. It is day 2. It's Sunday, July, what is today? I think the 18th. And we are day 2 of clinical at this hospital. And we are going to just basically see how today goes. I'm just gonna go ahead and just gonna do what I did yesterday, and we're gonna have the same 4 students, and we're gonna actually, I think, do labor and delivery today. And I'm gonna have 2, I think, on labor and delivery and 2 on mother baby, and then I will flip them after lunch where they can all have the same experience in terms of having some hours in labor and delivery. So we'll see what we have today. It's contingent really upon what the census is in labor and delivery. I don't know if they'll have a full house like they did yesterday on mother baby or not, but we will see when we get there. So I will check back in when I get to the hospital and get everybody situated and kind of let you know, give you an update about what's going on for today. All right, I am back. It is now 7:30 in the morning, and I have my 4 students, and I split them up. I put 2 in labor and delivery, 2 on mother baby. I gave the ones on mother baby a GYN surgery and a couplet. So they'll be taking care of about 3 patients apiece. And what we're going to do is at lunchtime, we're going to go to lunch, all right, hopefully around noon, and then we're going to swap. So the 2 students who are in mother baby will go to labor and delivery, and vice versa. So that's the plan for today. We'll see how it works out. So far so good, no complaints. They will be working independently today. Yesterday I was really more hands-on. Today I'm going to give them some autonomy to basically see what they do on their own, work on their documentation, get things like that caught up, and work on learning how to do an SBAR and give reports to each other midday so they can learn how to do that process here at the clinical site. I will check in a little later. So I'm back. It is now 2:04 in the afternoon, and it's been a great day. It's nothing really to report. I just wanted to come back on here just to have something to come back and say. We went to lunch about noon. They switched over. I had the students give report or SBAR to each other, and they took each other's place in L&D and mother baby, and they are doing their own thing. I've been sitting here grading papers, or grading assignments and stuff like that, trying to get that caught up in my grade book. And that's pretty much all that's happened today. It's been an eventful day. It's been great. They got to see a lot. They're doing a lot. That's pretty much it. So that's all I have for now. I will come back probably in the car for a car chronicle section, and that will be it. Have a good day. All right, and we are back. I'm in my car. The day is over. It's time for car chronicles, and we talk about basically what has happened today. The rest of today. I am early today, 5:31 in the afternoon, and we have car chronicles where we're going to talk about basically what has went on since the last time I checked in. And really much of nothing. It's been a calm, cool day. I actually got a lot of things graded today. I didn't get everything graded, but I got most things graded today and caught up in my grade book. But what I want to share with you is what I do in post-conference. So these are LPN to RN students, and what I do with each group of students is based off of the education level that they are at. So I don't do everything the same way with every clinical group because it's based on where they are. Education wise. So these particular students, like I said, is LPN to RN. And today for post-conference, what I basically did was give them all a topic to look up. So the topics I had them look up was, one person had to do nurse bullying, one had to do nurse burnouts, one had to do drug nurses that are addicted to drugs, and one had to do diversity in nursing. So that was the 4 topics today. So they had to look up these topics, and we had to have a discussion about them. They had to share, their thoughts about it, and I provided more insight about what it looks like in nursing, because as a nurse, you have to be able to look for signs and symptoms of abuse of drugs, burnout for yourself, bullying, things like that. And then you have to be able to handle those situations, especially if you're the charge nurse or manager. So we actually talked about that, and I do that with every LPN to RN group because they are going from one area of nursing in terms of LPN to RN. So I want them to have a better or broader scope of understanding of what that really entails and what it looks like. Number 1. Number 2, it lets them know that they are not alone, because they have all experienced burnout, bullying, and things like that. And sometimes when you don't talk about those things, because those are topics that we don't want to talk about, they then begin to realize that, okay, I'm not by myself. And it helps empowers them as they kind of go into their new role as nurses to say, let me start speaking up and talking for myself and not giving in to the narrative of being bullied by other people. So we have a great discussion on that. That discussion lasts almost about an hour. And sometimes when we get going, I cannot get my students to stop because they are really wanting to talk more about what it is or what issues they've had. And we talk about solutions. That's the thing. So it's not only talking about problems, but we need to talk about solutions as well. And I do that with my students. So we have very good post conferences because of that. So that's what we did today. We just finished that up. And this clinical group, you know, they're going to go on to mental health next week. And I will be going to another hospital next week with another group of students. So that kind of ties up what we've done for the past 2 days. I thank you for joining me. Keep in mind, I do go live weekly. So if you haven't been seeing my lives, please join us on live. And typically on Friday or Saturday that I go live. So please join us. And thank you for watching this video in its entirety. I hope you've enjoyed this vlog. As you know, I'm no longer working in the hospital setting, but I thought I would bring a different aspect of what I do. So this is my work vlogs, but they are the clinical side of me being a nurse educator. So if you happen to like this kind of thing, let me know, thumbs this video up, or just put a comment below saying that, you know what, I do enjoy this, keep this going, these kind of work vlogs going. So we have a better insight about at least what I do as a nurse educator, or if you're thinking about going into education yourself to teach or to be a clinical instructor, things that I do, and maybe, you know, things that can help you in your journey, or if you're a nursing student, things that you would like to talk about when we do go live, and we can talk about those things. And so those are just some thoughts that I have to kind of keep content coming your way. So if you happen to like those things, comment that below, thumbs it up. And until the next time, I'll see you in the next video. Have a good day.